What do you want in a doctor? Does it matter if your doctor is male or female? Well, here's a study that says that it does matter. Because women tend to follow the guidelines more in ordering prescriptions and follow-up examinations, and men tend to order procedures, the researchers came to the conclusion that female doctors are more productive. So what is a productive doctor, and how does this add up?
Well, that's a really good question. So the benefit of how the study came out depends on the eye of the beholder and who did the study, who invested the dollars in it, and what are they trying to achieve. And basically what they were talking about in this University of Montreal study is that women followed directions better and did the things in a study on diabetes of the Canadian Diabetes Association. And so they were doing more examinations on the eyes every couple of years. They were doing more regular physical examinations. They were using 3 drugs that they recommended should be used in all diabetics for the most part, which included statins and probably lisinopril and also probably metformin. And based on that, they said that women were better doctors. Well, what's that got to do with being a good doctor when it comes to all the things that you as a patient want?
Well, a productive doctor might not be the ones that they think, or that we think.
Well, they may not be the ones that are listening and caring and spending time with you. I mean, certainly we would have to agree that there are certain things that should be done.
So they're following the guidelines more, they're following the rules more. So there's not...
But who makes the rules?
So you're not getting credit for being creative.
No.
Thinking on your own 2 feet.
No, you might actually get penalized for that, because if you're not doing what they want you to do, then they're going to call you a bad doctor. I mean, it was the same thing, and it's the same thing today in HMO medicine, where if you don't follow the guidelines that the person that's paying your salary wants you to follow, you're going to be out of a job, and they'll call you a bad doctor, even though you may be doing far more good.
Well, can't this also happen with electronic medical records?
Oh, now you really hit the nail on the head. Electronic medical records sound wonderful, because what's going to happen is we'll be able to track people better. We'll know exactly what happened to them. Your records will be online and available to other doctors and hospitals. Marvelous, right? Wrong. Because what's going to happen is something far beyond that. They're going to be able to track what you do and reimburse for what they want, not for necessarily what you think is the right thing. And if you're more creative, it doesn't matter. They're not going to look at that as something that's creative at all. They're going to look at that as something that might not be cost effective. So electronic medical records are the nemesis of the doctor who's creative, who wants to do the best thing and spend more time with his or her patient.
This makes me wonder if it's more productive, when they're talking about a doctor being productive, if they mean more productive for the patient or more productive for the hospital. Or more productive for the pharmaceutical companies,
or
more productive for the insurance companies?
Yes. So who's doing the study is the judge, particularly in an article like this, which I pay very little attention to. So what kind of a doctor do you want? I think you want a doctor who's going to be sensitive to what your needs are, who's going to know you and listen to you, who's going to care about you.
Just like you.
Oh, yeah, and you as a nurse. Yeah, it's about being connected to the person and having a relationship with them that's very personal and sacred. And that's where the guts of healing occurs. It's not so much with the standard protocol that's one size fits all that results in doctors not being paid or being punished if they don't follow the rules.
And like this thing that they're talking about, the statins, like that's a good thing. I mean, that reminds me of a few years ago, they were talking about even putting them in the water. But some of these drugs are very powerful and can have really bad side effects. And we also need to be looking at patients, like you said, as individuals. Everybody's a little bit different. And to think that they just want to treat everybody just the same.
Exactly.
That doesn't sound productive for the patient to me.
Well, they don't really look at lifestyle. And lifestyle is our most powerful medicine. So it's diet, exercise, sleep, stress reduction, weighing what you should, avoiding toxic exposures, and having a purpose that brings you joy in life. Those are the fundamentals of the best care. Now, will drugs help some diabetics? You bet they will. And there's studies that show that statins do reduce heart attacks in people who have diabetes, and that lisinopril will help with kidney failure, and that metformin is probably the best drug to use if you're going to use a drug. But there's also all the flexibility we need in being able to do it the way we want, depending on who the patient is and what they can do in terms of lifestyle management.
Of course, they also ended up saying now there's a little influx going on, and that the female doctors are increasing their procedures, and the male doctors are taking more time with their patients.
This is all irrelevant stuff in my book. The way they are measuring things, I would like to be able to make the assessment myself about what a good doctor is or isn't, whether it's male or female. But I'd have to say, in general, Vicki, nurses and doctors, if they're female, have a lot more nurturing and caring. They're the ones that usually take care of patients. We doctors write orders for the most part in where medicine is going today. It's becoming more of an academic situation where you just follow the rules that the association agrees is the best for the patient. So when it comes to figuring out who's the good doctor and who's the bad doctor, we got to look at the criteria, who's setting up the study, and then make a decision that's more valid.
And it shouldn't be sexist.
Shouldn't be sexist at all. That's right.